So thank you. It's really lovely to be here to join you celebrating being part of a Scottish cohort. I'm Professor of Public Health, but I'm also a data scientist, and that's my interest in you as participants in a cohort. And it's a real privilege because we have a great team in Aberdeen, and it's lovely to have two of them here. But it's also a huge privilege because a busload of you have come down from Aberdeen to join us today. So by way of a cheer and a wave, so I know where you are, who's come from Aberdeen? There you all are. Look at that. It's great. So well done, you. Let me work out how to make the slides move on. So here you are, back in the 1960s at primary school, and this is when the study started. There were just over 12,000 children in Aberdeen in total who were aged 7 to 11 and who were born in Aberdeen and were at primary school. And they came from slightly bigger families than today. So on average, there were 3 in the family, but 6. So 1,000 of the kids in this population group came from families of 6 or more. So a little bit bigger than today, some of them really big families. And they were the foundation of something that was really exciting at the time in Aberdeen. So researchers were coming from America in collaboration with researchers in Aberdeen University to study brain development in these children. And it was an unusual study and very special in terms of the cohort because it was very inclusive, and all of those 12,150 children were going to be part of that study. And that's important, and it's unusual for cohort studies who often sample, and that becomes complicated because not everybody wants to participate. As kids, you don't even remember it, I don't think, for most of you. You were doing loads of tests at the time. You were part of the 11+ generation, so you were being tested all the time through primary school. And so these researchers came in and did tests, and when we've spoken to you, many of you have no recollection of this happening at all. It wasn't a big deal. But actually, it was a really pioneering cohort, because the other thing that they did that was really key is that they linked into other data sources that were already gathered, that were part of administrative systems. And you're special because you're also some of the first children who were, your information was stored about your birth in a thing called the Aberdeen Maternity and Neonatal Data Bank. And that still goes today and has recorded every birth in Aberdeen Maternity Hospital ever since. And that provided the thing that makes you a birth cohort, because the researchers could link you back. Not only were you at primary school in Aberdeen, but you were born in Aberdeen. And that gave them really rich information from the very moment that you were born. So in linking all of those data sets together, you became the second real key feature of you as a cohort, is that we have some of the richest early life information from your birth right through to your childhood of any cohort that's of your kind of generation and maturity now. And you've told us there were some things that were really key to you. So you've told us where you lived was really important. And you identify very closely with the tenements at that time, and you've told us stories about life in the tenements in Aberdeen and what a community it was. Aberdeen was like a village. It's a city, but it was like living in a village. And that you remember close life. The doors were open, and these were your family. And you could go into any of those houses and somebody would sort you out if you had a problem as a child. And so you shared toilet facilities. 1 in 12 of you didn't have your own toilet. A similar number didn't have a bath, shared hot water. But there were other things that were happening. Then you also remember the time you moved. So these were post-war tenements, and they were struggling for many of them. They weren't in great nick. They were quite hard to modernise as buildings, made of granite, not easy to change walls and layouts. And so the new houses were a big feature of the stories that you tell us about your early life when you moved to these new houses that had a bit more space. But you also learned to share, so Aberdeen was big in terms of fishing at the time. This is pre-oil. And you tell stories about the fathers amongst you who worked in the fishing industry and the mothers who worked in the fishing, often the processing plants that went with that, coming home with fish and sharing that amongst the community of your tenement, where maybe some of the families were having a harder time. Many of your dads worked in industry, again, pre-oil. Some of these industries were in decline by this time, so this was paper making, some of the industry that went with shipbuilding and with the fishing industry. It was also still a time of transition. For 7 of you, you reported your dads were working in horse-drawn type activities. So this was still a time that Aberdeen was transitioning. You also told us that school was really important and had big influences on your life, and that the teachers were important to you, some of them shaping your futures. And the friends that you made there, you brought along to a reunion event, and you were still pals with some of those friends that you made at school. Aberdeen was quite special for schooling at that time because it was actually had a better standard of education. You stayed longer in school than your equivalent around the rest of Scotland, particularly considering some of the challenges there were in terms of employment at the time in Aberdeen. So school was an important driver, and you recognise that. Church was important too. So 1 and 2 of you, 1 out of every 2, 50% of you were involved in a church group. Of some sort of Sunday school or some kind of club related to the church. TV was there. Your mum's favourite programme was Coronation Street. And lots of you got comics, so 3 out of every 4 household was a bit of a fan of a comic. So you were enjoying some of the fun things of life. But here you are now. So proud Aberdonians, that came across really strong when we got you together a couple of years ago. You really identify with that city. And you were really enthusiastic citizen scientists, which is great for us, because you wanted to know more. We laid out some of the questionnaires that you had answered as children, and you were there filling them in again. We had to rip them back from you, because they're the only copies we've got. So you're really keen to participate in science. Nearly 6,000 of you keep in touch with Heather, who's over here, and you'll all know Heather, but Heather's been the study manager, the cohort manager, since it was revitalised in 2000. By Professor Batty, who's here as well. Where's he gone? He's sitting there. And you've been involved in 3 types of studies. So in 2001, Professor Batty sent surveys out to just around about 7,000 of you. Participated in those surveys, gathering similar information to when you were children, about your life and things that had happened since. This time you do remember filling them in. But you were also, we built on that pioneering activity of those first researchers of linking your data up. So we've used your study in cohort and questionnaires, and we've been able to link you to things like your health record data and understand in a really efficient way lots of things that are beginning to happen to you in terms of your health. And we have 8 teams of researchers at the moment in working with that kind of data. And some of you, so 513 of you, I think, are in Generation Scotland. And of those, another 284 of you have had your brain scanned, a little bit like the ones that we're seeing of the babies. So you're really participating and giving really rich data. And we look after that data for you. So Heather manages the main cohort data that's been gathered since you were a childhood. And when we're linking to other data sets, to be able to exploit that real strength in Scotland, which is our ability to join up our record linkage through healthcare data, because we all have this one identifying number that links all of those pieces together for us, then we look after it in a place called the Data Safe Haven. And researchers, rather than taking data sets away, come in and log in and access that data in a really controlled way. And the data's anonymous, so although I'm talking to you as if it was you, we can't identify you when we're looking at your research data. It's all anonymous. That works really well for you because, well, you haven't moved a lot. So 88% of you are still in Scotland today, and 75% of you are still in Aberdeen or Aberdeenshire, so still around that locality. And that means that when we link up your records, we can still follow you because you're not moving around. And that becomes the third really key feature of the cohort, is because you are still in Scotland, we can create this really long record of your healthcare and set you in the context of environmental data and other types of census, small area statistics data that allows us to see how Aberdeen has changed and how the bits of Aberdeen that you've lived in have changed along with you. But the key thing about the cohort is you as participants, because you have enthusiastically engaged with us, and you're starting now to shape and tell us what mattered to you. So you've told us the stories about going to the beach with your families in Aberdeen and what a great picnics and parties and games that happened there. You've told us when David Bowie came to sing in Aberdeen, that was clearly a big deal. And you've told us about what you did that week that typhoid broke out and you got a week or two off school because of the typhoid outbreak in Aberdeen. But importantly, you've told us that you think that family, community, and school were real key shapers in your lives, and that that's influencing the way you act and your experiences and how you're approaching life moving forward. So I want to spend a little bit of time then sharing a bit of research that we've been doing recently that's beginning to try and unpick that story. So the early life and school and how that's interacting to impact on your health now. Education had changed for you from your parents. So for you, 3/4 of you stayed on in school after the age of 15. That was becoming the norm thing to do. For your parents, 3/4 of them had gone by the age of 14. They'd finished and left school and gone out to work. 1 in 5 of you went on to get degree-level education. And that was higher than kids of your peers around the rest of Scotland. And the other thing that was a strong changer over that time is what your dads did. So for you, 65% of you are in professional, managerial, skilled, non-manual occupations. For your parents and your dad's job, it was about 20%. So there's been a big shift in terms of the kinds of work that you're doing. But we know that your dad's job was important. So it's important in terms of shaping your social experiences and your economic experiences when you were young. It shaped how long you stayed in education for, and it influenced the kind of jobs that you went on to in later life. And so to be able to study that and how that is impacting on health, it's been really important that we've got that survey that you did in 2001, because it's told us some of those other risk factors that we know impact on health. Whether you were overweight, so 5 in 10 of you in 2001 reported that you were overweight or obese. 3 in 10 of you were smoking. 2 in 100 reported that you'd had a hangover in the week prior to the surveys. That's an estimate of drinking behaviour that's quite commonly used in surveys, because if we ask, none of us confess to what we actually drink. But 1/3 of you by that point in time had been admitted to hospital. So we were beginning to be able to start that continuous record of being able to link you to your health records and find out what had been happening to you in terms of your health. Over the last winter, you'll have heard a lot of conversations in the media about the pressures on the NHS and how that pressure, those long lengths of stay in hospital, the burden on beds, is really impacted by the fact that today, rather than us having one illness, most of us or many of us present to hospital with maybe 2 or more conditions that are complex and serious. And that's making healthcare hard. It's harder for us as individuals, but it's also harder for the health system to cope with that. So we've had a group of researchers who've been beginning to try and understand, is that influenced by things that happened early on in life? Now, we know from your cohort, the children in the 1950s, and some of the other ones that we've been hearing about today, that the earliest moment in life, even before birth, we're started on a trajectory of things that will influence the kinds of diseases we get later in life. We know that heart disease is associated with the earliest life before you're born, not just genetics, but other complex factors that play out around your social and your economic experiences, and then the risk factors that you accumulate through life. So we know that for individual conditions. What we've been looking at is whether that plays out when you start to look at multi-morbidity, so 2 or more conditions. And we found that in the cohort now, that 1 in 5 of you have been admitted to hospital in the last 5 years, and 1 in 10 have 2 or more conditions that are serious enough that have been recorded in your hospital, your inpatient hospital records. That means that they're causing significant impact to you. And we can see over time that that's increasing for you by following you through these health records. The things that we know are important, we know and can begin to see from your data that they start early in life when you're a baby. So we know that for those of you who are born into families where money was tight, so lower income, and your dads had a job that didn't pay as well, that you were more likely to have multi-morbidity, to have been admitted to hospital with these 2 or more conditions. And that, for many studies, that's what we call socioeconomic status, and that's, for many studies, is as far as we can go. But you and the cohort studies are really important, because there we can start to unpick that. What does that mean, and what things are influencing that? And the variations between different people in the cohort allow us to do what we call natural experiments, where we can compare whether different scenarios for different groups of people might plan out differently, and gives us a little clue as to what might be happening. So looking in your study, we've had a PhD student who's been working for the last 3 years and has just finished, who's been looking at education in the cohort. And she's been able to show that how long you stayed in education has begun to protect you from some of the impact that lower socioeconomic status, that the poverty that we were talking about, might have impacted on your health. By staying longer in education, you gain some protection. Dr. Butler, who's sitting up here, who's come down from Aberdeen as well, is beginning to pick a bit further, because you were some of the last people who went through the 11+. And streaming based on your scores at school, we can begin to explore a little bit further about what that meant in terms of how you'd performed and which schools you went to. And she's running a study just now with colleagues in Glasgow that's beginning to play out whether how you were chosen for which school you went to might have impacted and influenced not only what jobs you went on to do in later life, but also your health implications. And she's here so she can tell you about that over coffee. So where that places us then is that Scotland, we're all here celebrating Scotland as a really rich, important resource in terms of cohorts. But during the 1950s, I would argue, is really important within that landscape. So for cohorts of this age, so for people who are 40 or older, who are in a birth cohort, during the 1950s is large on that Scottish stage. And this inclusive nature of it, that it was all of you, every one of you that went to school at that time, is really important. Those really rich early life records that we've got, and all of that information around what life was like in Aberdeen through those early life, is fundamental for us understanding what's happening now, and our ability to link to your health records and to other records as time moves forward in that longitudinal way, so we can see what trajectories you're on, is really key. And your participation in Generation Scotland, and all of you who are contributing to Generation Scotland, we're all contributing to that bank of really rich research data, really detailed research data. So your contribution across all of that is really important. But you are the most important of that as these citizen scientists. Now, we've done lots of research to you, but things are changing. We've just been funded to start a really different way of working with cohort participants, and that's to do it in partnership, to really take you on as research partners. And a team of you, I hope, over the next few months are going to join us to design what the future is going to look like with the children in the 1950s. So you've already started to shape what research you tell us is important in terms of how you live happy lives and healthy lives as you age. Can we learn things now from the experience so far that will influence and shape the lives, and we can use to shape the lives and policy and care for our children? And can we help use the cohort to shape how we deliver healthcare and how we live well for the current generation? So you're already there helping us do that. We're going to get really round the table with you and work out the details of what that means for you and how do we gather the data. But you're already starting some of that journey. So this is you meeting our medical director, who's in the kind of back right corner for NHS Grampian, and starting that conversation around what was important to you around health. Your cohort reports were the core of a story that our Director of Public Health told last year in her annual report, where she was championing the cause of investment in early life and childhood. And she used the children in the 1950s and what we know about you as part of that core policy shifting, so that she could bring partner agencies from education, from social work around a common problem to try and work together. But this is the end of perhaps a beginning in terms of the children in the 1950s. This is just the start of a really exciting journey as we work together to study and understand what life is like and how it's influenced and changes over time. And we want to create the children in the 1950s. There's a really rich, important research resource, not just for us in Aberdeen, but for researchers across the UK, where we can study the trajectories of physical and mental health and the complexity of the factors that determine that health and experience of health as we age, but really driven by the outcomes that you as participants in cohorts, whatever the cohort, tell us are really important.